A certain retirement home in the GTA has had over 70 fatalities because of COVID. And there's a problem with retirement homes. There's an inquiry going on in the province, but that's an inquiry. No solutions yet. Marc Kealey is a former hospital administrator, and he knows about retirement homes. I'm told that one of the problems with retirement homes is that so many of the workers are minimum wage, and they aren't trained. And they have to work at 2 jobs, so they go from one home to another home. They spread it around.
I would even go one step further. Probably the first point of entry for a system of long-term care are personal support workers. And personal support workers are high touch, and they're the lowest paid. And I got to tell you, this is the biggest issue that we're facing right now in this province and across Canada. We're the best country in the world for the healthcare delivery that we offer, and we can't pay personal support workers the best.
How can you say we're the best country in the world if we're paying people minimum wage to go in there and take care of the elderly?
Well, I think your point is well taken in terms of what we need to do for increasing better access to healthcare workers by paying them better. And personal support workers, as I say, should be paid more so that they don't have the option, or they're not forced for the option of having 2 or 3 jobs to make up for the lack of income that they're getting from the only job that they might have.
And what about training? I'm told that the training is quite paltry in most cases.
Well, it's getting better, and I think it should be a regulated profession. And once it becomes a regulated profession, you can increase the compensation for that role. And I think I would strongly advocate for that.
Are all of the sins of previous governments coming home to roost right now? Because, I mean, no one thought of retirement homes when COVID started to spread.
I've said this to this current government. I think that we had 15 years of a government that really gave short shrift to long-term care. Yeah. And I don't think we're educating patients and people enough to know that these guys are wearing what had happened over the last 15 years.
So really, higher wages, more training, perhaps regulated industry. Yes. Should it be privatized? Because I'm hearing that people are saying, some nursing homes right now are just handing out huge dividends. They're getting money from the government, giving it to the shareholders.
Well, a lot of it is privatized. And I think if you go back, one of the things that we should be doing is looking at unionizing, and this might be something that your viewers might be bristling at, but I think we should be unionizing personal support workers so that the quality and the compensation is better.
Well, Jerry Dias is sat in your seat. He's the president of Unifor, and he is saying the same thing about not only grocery stores, but nursing homes. Okay, huge problem. Thanks for shedding some light on it. Marc Kealey.
My pleasure. Thanks, Stephen.
3 minutes. So thank you for watching, and please make sure that you subscribe and tell your friends. We are going to have lots of fabulous shows coming up in the new year.